Hi, I'm Dr. Christin Gooding. I'm one of the veterinarians here at Dove Lewis. I'm a critical care specialist and the director of critical care. And today I want to talk to you a little bit about the novel canine infectious respiratory disease complex that has been going around and causing a lot of questions and curiosity both from clients as well as other veterinarians in the area. So Dove Lewis started to see some atypical respiratory cases starting in about spring of 2023. And whenever you see novel cases as a veterinarian, you start to report that to the veterinary state, which would include the Oregon Department of Agriculture. And there was an uptick in this novel strain or a novel disease process that was going around the Portland Metro and the Willamette Valley area. And so the Oregon Department of Agriculture has been kind of spearheading an investigation to try to find out if there's any type of infectious pathogens that could be causing an infectious disease of this sort. And so things that we have found here at Dove Lewis is that there is two kind of subtypes of clinical signs that we have seen or disease courses of these dogs. They tend to be younger dogs, and some of them are larger breed dogs as well. There has been histories of them being boarded in certain kind of high volume areas like kennels, as well as sometimes doggy daycares, and potentially even grooming facilities as well. So kind of like with any type of respiratory disease process, when you have more contact with another dog, you're going to have more exposure to infectious diseases. With that, we wanted to actually be able to test on if we found any pathogens. And the two subtypes we've kind of found is that these patients either have clinical signs associated with either a chronic tracheobronchitis, where they have a dry cough, maybe some ocular or nasal discharge, lethargy, and they go to their veterinarian and they start a first round of antibiotics. However, they don't respond to that antibiotic, or they have a relapse within anywhere between 4 and 8 weeks. The other subtype seems to be much more of a lower airway disease process causing pneumonias. And again, some of them do trace back to having some type of chronic tracheobronchitis prior to, and then again kind of responding and then having acute onset of pneumonia. And that's when they actually start to have respiratory problems as well. So warrants an emergency visit in those situations. And some of them have required intensive care, where a majority of them have been able to recover with outpatient therapy. And so with any infectious canine respiratory disease, we're always looking for clinical signs. So again, ocular nasal discharge, lethargy, respiratory difficulty, dry coughing, sneezing, any of those signs should warrant a visit to a veterinarian. And then they can do a slew of diagnostic testing, which we hope in the acute phase might find some of these pathogens. There are many different viral and bacterial diseases that can cause respiratory infectious canine complex. And again, some of these novel strains are the ones that aren't sometimes coming back with any answers for us. Other things that your veterinarian can do is chest radiographs or even endotracheal washing for bacterial cultures. Beyond that, there is specific treatment that we would want to tailor. First of all, we want to choose the right antibiotic for a patient, see how they respond to that antibiotic, as well as other things like rehydration, cough suppression, and also just making sure that their gastrointestinal tract is able to kind of handle any type of respiratory illness. The more affected they are, some of them actually need 24-hour care, where they're hospitalized with oxygen supplementation as well. And so we're really proud to be actually one of the hospitals in the Portland area to be contributing to sample collection for the Oregon Department of Agriculture. And if anyone is interested in getting more information from the ODA or wanting to be part of sample submission, that's where you can contact the Oregon Department of Agriculture's Public Relations Office, and they would be happy to take in more samples because they are trying to determine with a really wide net of clinical signs what type of pathogen pathogen or if it's more of the body's reaction to a pathogen. At this point, again, far and away, most of the infectious canine disease complexes are already known pathogens that we can easily treat and identify. Things to watch out for, again, is being really diligent about clinical signs, going to the veterinarian, and getting diagnostics right away to actually be able to tailor that treatment to make sure that they are responding to whatever course of treatment that's recommended. But when it comes to actually trying to prevent the disease process, both a potential novel strain as well as any already known strains, there's a couple things to be aware of. One, there are certain dogs that can be predisposed to infectious respiratory disease, such as older dogs, very young dogs, and some immunosuppressed dogs for another reason. So chatting with your vet about if your dog applies to any of those conditions, that may provide you some more diligence on making sure that avoiding high risk areas or high populations where dogs congregate would be a good idea. Other things that we can focus on is vaccinations, right? So vaccinations, we do have several vaccines that both target viral diseases as well as bacterial causes of respiratory illness in dogs. And not only can it potentially prevent from some of these bugs being caught, but just like with humans, it can absolutely help with decreasing the duration of the clinical signs and the severity of those clinical signs as well. So talking to your veterinarian about vaccinations, especially before going to, again, a high volume area where infectious diseases can happen. Communal water bowls is another thing that at dog parks, we really like to keep our dogs hydrated and outdoors. Well, that's going to be a really great area to congregate infectious diseases. And the infection actually transfers from nose to nose touching as well as like aerosolized droplets that can result on the surface for even up to several hours. And so things like communal water bowls, again, increased contact with certain areas in dog parks and kennels and things like that can be a place to pick them up. I would like to say that, all kennels, grooming facilities, as well as daycare facilities, they do a tremendous job cleaning their facilities between animals and while animals are staying there. They're also very abreast to knowing if there is an outbreak. So I wouldn't say avoiding these high population areas for most dogs is necessary. I would just say make sure you're watching your dog for clinical signs. Contacting any of those facilities prior to potentially boarding is always a good idea. And then trying to avoid some of those situations if your dog is predisposed and thinking about vaccinating your dog if at all possible.